to be unprofessional. I'm upset. I just quit my job. I clocked in, find out that I'm being sent to a corona floor when they know that.
Guess what, bitch? Coronavirus! Coronavirus! Shit is real! Shit is getting real! Shit is real! Corona.
Yeah, what's up? This is your girl Nicole, reloaded, and I'm loaded up, with another video. I'm over here on Tamron Hall's show. This is Nurse Melissa. Nurse and mother of 5, Melissa Thomas Scott, recently quit her job on Facebook Live after stress and fear for her own health being compromised brought her to her breaking point. Now, the question is, would you have done what Melissa has done? Melissa is a nurse that quit her job during a pandemic and a crisis, and nurses take oaths.
So you are defined as having a pre-existing condition, even though you're a healthcare worker.
Exactly. I still have to see my oncologist every 3 months, as a matter of fact. So I wasn't supposed to go back to these units from what I was told.
But you ended up going back to this unit, not only to this corona floor, but your hospital, currently the largest number of cases in Georgia, are at the hospital where you worked.
We're one of the leading. I don't know if we're the top ranked. I haven't checked the latest numbers, but we have a pretty large amount of cases at our hospital.
So you have this huge, influx of people coming in, diagnosed and not, but showing symptoms. You already have a compromised immune system. And to add to that, as I understand, you felt that you didn't have the proper protective gear that we're hearing so many other healthcare workers talk about around the country.
There's a nationwide shortage of PPE, protective personal equipment, so we're being required to reuse the same gown and same mask the entire shift. I as well have.
Can you, if you were a nurse, did not have the proper protective gear, and you only had one set, would you be able to continue doing your job? Or would you Lysol it down during this pandemic, extra scrub, and continue to work?
As well as others, we don't feel that that's safe because prior to this pandemic, that's not how we did it. If we went into a room, came out, had to go back in again, we got something totally new. So, yes.
So when I saw the video, I thought, did she snap? Had she been fed up? Because listen, all the healthcare workers I know, I've got nurses in my family, y'all do this because you love this job. You want to help and serve people. Was this a snap decision? Was it a rash decision?
Okay, let me just say that I reacted out of stress, fear. I was already, worried about everything because my husband expressed the concern that he didn't want me to go because of not having the protective gear. He said if they don't have the supplies to protect you, you don't need to be assigned to those patients. He's away. Another concern is he's working in another state. If I were to be come into contact with something and have to be quarantined, there's no one here to care for my children. I'm their primary provider right now. So there were a lot of factors behind it. I love my job, let me just say that. I've been a nurse for...
I hate that she feels guilty. I really do. I really, really feel bad that she feels guilty. She did what she had to do. Let me know down in the comments, do you think she did what she had to do? Or was she supposed to continue to stand there during this pandemic, okay? Now, some of the comments says, underlying health conditions triggered her rash decision. Probably would have done the same thing. No job is worth your health. A husband out of town and 4 children, two small ones, it's going to be fine. God has you. You made the best decision you could at the time. These corporations will have nothing to say or give your children if they lose their mother. Stand on your decision. and God bless you. These corporations don't care about us. It's about the dollars. My company put me on part-time with reduced pay. They let my co-workers go only after the both of us had complaints on the company. This is big retaliation. Prayers to all healthcare providers. Bless her heart. She made a decision for her and her health. She did the right thing, especially being optimistic that nurses shouldn't have to try to force her to go on that unit. Okay, I said that wrong. That nurse shouldn't have tried to force her to go on that unit. She has children to worry about. So, by her previously having cancer, makes her immune system compromised. So she's more prone to contract, an infection. So that's the reason why her oncologist stated that she shouldn't be working in certain parts of the hospital because it makes it high risk for her health.
3 years now, and I care about my patients. I did not want to leave my job.
Do you want to go back? Do you want to rejoin your colleagues or a different hospital and get back out there and deal with these cases and help people?
I worked hard for my nursing degree. Of course, I don't want to just give up nursing. That's not even a thing, and I love where I work. I doubt since I went to social media, they're not going to let me come back, and I do regret how I handled it. But like I said, you're not thinking clearly when you're upset. I have a great working relationship with all of my coworkers. They don't agree with how it was handled. If the opportunity were there, of course I would go back. There's still other patients that need to be cared for. I regret how I handled it, because if I would have remained calm and just thought it through, I wouldn't be here right now.
Real quick, do you have a message to other healthcare workers who might be at that brink, whatever the circumstance, where they go home and they just feel that this is too much to handle? What's your advice?
What we're going through right now, it's very important, and we need all the help that we can get in the healthcare field to combat this epidemic, or this pandemic, I'm sorry. But at some point, your life matters, your health matters, your family matters. And I just feel like I was left with no other choice, basically. Just, I don't know, show compassion in situations. Act like you care about your colleagues, and we can get through this together. I mean, there's a way to handle things, basically.
Melissa, thank you so much for talking with me.
Melissa is definitely a strong woman to stand up in what she believed in. But if she could go back, she probably would have handled it a little bit different. I doubt that they will let her back at that job, but you never know. Maybe they can give her a pass. She had an emotional, you know what I'm saying, breakdown and went to social media. I don't know. But I'm also going to provide the Breakfast Club interview and her Facebook Live. And y'all let me know how y'all feel about things.
Melissa Thomas Scott.
Good morning, Melissa.
How are you feeling this morning?
Peace, Queen. How are you?
I'm good. My cousin that lives in New York called me, and she said, they're talking about you on the radio up here. I was like, what?
That's Shaniqua. Shout out to Shaniqua.
That's only my cousin Shaniqua, yes. That's only a small part of the story, what everybody's saying. There's so much more behind what forced me to make that decision. I mean, I didn't want to leave my job. That's the last.
Now, wait, Melissa, before you get into it, just for backstory in case people didn't hear, you quit your job on Instagram Live. You're a nurse.
Okay, so for starters, when the coronavirus outbreak, came to our area, I've already taken care of coronavirus patients. I've already been assigned one of those patients, okay? After that patient, it was a patient that was being tested for coronavirus, for starters. My concern, I even brought my concern up to the charge nurses, my team leaders. I'm like, hey, here's a part of the story that people don't know. My husband is in another state. He's not even here. Like, if I have to self-quarantine, who's going to watch my children? It's not the fact, because I have children. It's who's going to watch them if I have to be self-quarantined. That's the thing. After I took care of this initial patient, I felt sick the following weekend. Like I was coming out with a cold, and all I could think about is was this patient positive? So when I went back to work, I asked my team leader, I said, how do we know, or will we be notified if our patients come back positive? Oh, yours was positive. Your manager, I don't want to say her name, the manager should have sent you an email. I said, she didn't. I pulled it up then, we looked, double checked, no email. Everybody else that had contact with this patient, they're like, oh, she called us, she emailed us. I felt some type of way about that. I said, why didn't she contact me? Because,
Now, what are your thoughts while listening to this Breakfast Club interview when Nurse Melissa Scott opens up about quitting her job? How do you feel about her main manager not emailing her, letting her know what was the test results of the patient that was testing with coronavirus, but the other workers received phone calls? What do you think about that? Leave your comment down below. Make sure that you like, share, and subscribe.
I should know. So then my team leader said, well, it's probably because you had the proper PPE on at the time of care. I did not feel comfortable with that because there have been reports of still contracting the virus, even with the proper PPE. So I, followed up with people I know in upper management. I even called employee health. Both said whether or not you had PPE on at the time of care, your manager is supposed to notify you. And I was never notified. Oh, I even approached the manager. She was very nasty whenever I asked her about it. And I didn't get the answer I needed. In an email I sent her, she told me that the only people that were being notified were those that had direct contact with the patient prior to being put on enhanced precaution. I didn't feel comfortable with that, so I waited to see if somebody else might have had a similar situation, like one of my coworkers. And it did come. One of my coworkers, same situation as mine, on enhanced precautions at the time of care. Her patient ended up positive. She was contacted by our manager. And so I sent her another email asking her again, why was I not notified of my patient's positive status? And then that's when she said, call me. No, you're trying to say something in a phone call that you can't say in an email. That's what it is. You're trying
She don't want to keep that paper trail.
Thank you. And that's what I was trying to do, a paper trail on her because she knows she messed up. She knows that she messed up. And so, I think that this was retaliation against me because I was on her ass about not notifying me. Okay, and let me just make it clear, not one time did I bash my hospital. When I made that video, I wasn't thinking, oh, you still have your freaking badge on. There was so much that occurred before that video was made that pushed me to that point. So prior to that, all weekend long, my family, my husband, they're all saying, Melissa, we don't think it's safe for you to go in there because my hospital has one of the highest cases in the state of Georgia. My coworker, she even called me on the way to work. She said, I'm about to call and see where they have me scheduled tonight because if they had me going to the corona floor, I'm calling out because they're not making the travel nurses work these floors or close to these floors. They're getting paid the hazard pay. We're not getting paid anything. We're not getting paid anything extra for this, okay? And it's not about the pay, but you're paying these other people $5,000. Why is this nurse, I don't know if the other floors are doing it, why is she not sending the travelers, but you're sending your regular staff, and we're not even getting paid extra for it? So
Good question, nurses don't, healthcare professionals don't get hazard pay?
Not in my area, they don't.
Now, Charlamagne, you just asked about hazard pay. Yeah, I asked do nurses get hazard pay. She said,
I'm professional, I'm upset. I just quit my job. I clocked in, found out that I'm being sent to a corona floor when they know that I have kids at home who I can't send away to stay away from me. My manager sent me to a floor that is being tested for corona. She knows my health history. She knows all of this. I quit. I care about the patients and all, but my family and my life, they matter. They come first. Is evil. She's evil. She knows my health history. I told her my kids don't have anybody to go to while they're here. I can't send my kids away like everybody else. I'm done. I'm leaving. My life matters and my kids matter. Screw this.
It's real. Shit is getting real. Shit is real. Coronavirus.
in her area.
Now, it should be mandatory that all nurses in the United States of America, and as well as doctors, should receive hazard pay. Period. Also, let me read a few of these comments. It says, there's a lot of bullying in the nurse profession. America's healthcare is garbage. Just a bunch of money-hungry, selfish people who care nothing about workers and patients. They need to be paying these people double. They're literally at war. I quit my job yesterday and I'm a mental health therapist in healthcare setting. No regrets. They don't care about us or the patients. Money, 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 money. God bless all the health professionals who are putting their lives at risk. The real America is being exposed, inadequate, ill-equipped, and everything else ill. The nurse has underlying health issues, serious health issues, and they didn't reassign her to another ward? What the Fraggle Rock? She made the right decision to quit for her life and protection of her family. The American dream. Crap has been sold to us by narcissistic for centuries. This pandemic is exposing exactly what this American dream really is, a facade. How can the most powerful country in the world not be ready for something like this? Are you telling us that the American dream consists of not having enough masks or ventilators or hand sanitizers or toilet paper or even the necessary medical staff? Not even having adequate medical health care? It is time to get these criminal politicians out of power. They keep suffocating us by doing absolutely nothing for us, yet pocketing millions for themselves. Already enough. I don't blame this nurse for anything. I am thankful for all the work you have done to help the sick, Mama. I hope you're able to find a better employer.
Her job.
Right, we don't get it.
So what do you hope to gain from all of this, Melissa? Like, what are you hoping to get out of all of this?
I wasn't trying to gain anything. I didn't even think it was going to spread like this.
Right, it organically went viral.
That manager needs to go. I'm not the only one that quit that day on my floor because of her. Yes, like I said, there's so much more to this story, y'all. When I gave her a chance, everybody knows details. They will know I made the right choice. This was purposely done because she knew that I was on her ass about not notifying me about my patient's positive status. That was wrong.
Melissa, would you go work at another hospital right now?
If they place me in the right areas, of course. I don't want to be subjected. I was already informed by my charge nurses that I work with. They said they told the manager of my status, my prior medical history. And she assured me, she was like, you don't have to worry about being assigned to those patients. You never should have been assigned to that first patient.
Right.
They assured me. And so if I don't have to go to this other patient, why are you going to send me to a whole freaking unit of those patients? Even the nurse that gave me that first patient, she came to me and she said, oh my gosh, Melissa, you should have told me you're a breast cancer survivor. I never would have sent you to that patient. And she's the same one that was there the day I quit. This was purposely done and nobody can tell me otherwise.
Yeah, I mean, the only way America can get the best out of their healthcare professionals is to treat them with care. If you all aren't feeling like y'all are being cared for, how are y'all going to care for other people?
And I need to also add this. Last week, or the week before last, they've been floating an older nurse with a breast cancer history around, trying to keep her in safer areas because she usually works in the ICU. She's been working on my floor for a couple of nights. They sent her to the corona floor. That nurse manager called my manager and, trying to get her back on my floor. My manager refused. That manager told her, from what I'm being told, we must not only look out for our patients, but we have to protect our staff as well.
That's true.
The manager refused. It's a pattern with this person. So,
right.
Okay.
Like I said,
so it was something personal. So this was not something that's going on everywhere. This is just something that you feel like this manager made some poor decisions and had a personal issue.
Exactly.
Now, do you guys have the PPE? Do you guys have the necessary PPE that you guys need?
There's a nationwide shortage, so we are having to reuse the same gown and same mask the entire shift. Prior to this outbreak, that was not the standard. And I don't feel comfortable with that, and neither do a lot of people. That's unsafe. I'm sorry.
Right, I agree.
Unsafe at all.
I think this is an indictment of America's healthcare industry more so than it is an indictment of you. No, Melissa,
we do appreciate you, yes, for letting us know the real behind the scenes of what was going on.
I thank y'all for letting me share my side.
Melissa, can I ask you one more question? Do you think it's possible that being that this is a new situation situation that, nobody has ever dealt with before. Maybe your manager just didn't know what the proper protocol was?
She knew. She knew. She knew.
Well, thank you, Melissa, for so much for checking in. And
like Melissa said, she knew. What do you think the reason behind this manager? Why didn't this manager let Melissa know? Why? Hopefully Melissa can get her job back or get a nursing gig somewhere else where she is treated with respect. The respect that she deserves and to be protected. To all nurses and doctors and CNAs and LPNs that are out there, thank you for your services, your hard work, your just due diligence, and giving it your all. Standing up for your country. Your country needs to stand for you.
If they ever ask about me, tell them I was more than just a great set of boobs. Nicole, really?